Hi everybody, Dr. Ahles here. In this short video, we're going to talk about two important disorders of the process of blood clotting. The first disorder we're going to talk about is something called thrombocytopenia. And remember from a previous video, we said that thrombo refers to platelets. So thrombocytopenia means I don't have enough platelets in my bloodstream. To give you a little frame of reference for thrombocytopenia, what this typically means is that I have about 50,000 platelets per microliter of my blood. Microliters, very small, but I only have 50,000 of these platelets in there. This is a hugely low number considering that we usually have at least 3 times as many or up to 9 times as many. So the amount of platelets I have, very, very small. What causes thrombocytopenia is damage to the red bone marrow. Let's underline, highlight, star, red bone marrow. This is an issue at the level of synthesizing these platelets. I don't have the cells that actually build them. Whether those cells were damaged with cancer, radiation, some kind of medication, because I don't have those cells to build accurate platelets or functioning platelets, I don't have enough. When we think about thrombocytopenia, having too few platelets, some of the main symptoms of it include bruising very easily, bleeding for a long period of time, it taking a longer time to clot, but really the cardinal symptom, the easiest way to diagnose this is what we call petechiae. So petechiae, like we see in the picture here, are small red or purple looking spots that we find throughout the skin. What causes these petechiae is the little tiny blood vessels in the skin rupture, but we're not able to close them fast enough. We're not able to make that platelet plug or go through the whole process of coagulation. So if I don't have enough platelets, I bleed longer than normal, I can't patch up my blood vessels, that's petechiae, and also I bruise very easily because my blood vessels will rupture very easily. Let's compare that with something called hemophilia. When we talk about hemophilia, this is not an issue with platelets. This is actually an issue with clotting factors. So clotting factors are the different kinds of proteins that are activated by tissue factor or platelet factor that lead us to go through the process of coagulation. When we talk about hemophilia, this is a genetic disorder. So what a genetic disorder means is it's encoded by the DNA that you get from mom and dad. We would say that this is an X-linked recessive disorder. What that means is there's a copy of this gene on the X chromosome. If you're a male, you only have one X chromosome. So if you have that copy of the gene that leads to hemophilia, you will have the disease. If you're a female with that gene, you would actually need 2 copies to express hemophilia. That's because you have an X chromosome that still tells you to make these clotting factors. But when we look at the inheritance pattern of these genes, let's say dad has the disorder, has hemophilia. When he reproduces with mom, he gives his X chromosome. His X chromosome has the gene for hemophilia. Dad gives his X chromosome only to daughters, only to girls. Based on that, they'll be what we call a carrier. They don't have hemophilia. Dad gives his Y chromosome to his sons, they're completely unaffected. When we look at mom, if mom is a carrier, meaning she has 1 copy of this X chromosome, half of her children will get that X chromosome that has the hemophilia gene, which means her son with only 1 X chromosome is going to have hemophilia. But her other son, potentially, or we have a 50% chance of this, her son would be unaffected if she gave him her X chromosome that did not have the gene. Big picture. I'm not going to ask you about specific inheritance patterns, but here's what I want you to know when we think about hemophilia. It's much more common in men than in women. because to have hemophilia, you need 2 copies of this gene if you're a woman, only 1 copy if you're a man. How would we know if a patient has hemophilia? There are several symptoms, actually very similar to thrombocytopenia. So excessive bleeding to the extent that really we can't clot our blood. We're missing those clotting factors. Again, easy bruising like we talked about. But the cardinal symptom for hemophilia is when there's bleeding inside the joints of the body. That is completely atypical. If we find blood in those joints, we're going to suspect hemophilia. So when we think about blood clotting, having issues with easy bruising or excessive bleeding, prolonged bleeding, these are caused by issues with the clotting pathway. Whether it's that I don't have enough platelets or whether it's that I don't have functioning clotting factors. Both of those are necessary for me to be able to clot my blood and to not generate these little petechiae like we see here, or seeing bleeding all the way inside the joints of my body.